Buoy Health Insights, Sinus Pain. Hello everyone, and welcome back to another episode of Buoy Health Insights. In today's episode, we're exploring the common yet often bothersome issue of sinus pain. If you've ever felt pressure in your face or had a sinus headache, you know how uncomfortable it can be. Let's dive into what causes this pain, the associated symptoms, and when it might be time to seek medical care. Sinus pain can occur when the sinuses, those air-filled pockets behind your nose, cheekbones, eyes, and forehead, become inflamed. This is often due to an infection from a virus or bacteria, or it can happen during allergy season. The linings of these sinuses produce mucus to trap foreign substances like allergens or viruses, but sometimes these defenders are overcome, leading to an inflammatory response. Now let's look at the potential causes of sinus pain and the other symptoms that may indicate underlying conditions. It's important to understand these because they can help determine the best treatment approach. 1. Acute viral sinusitis. This is when a virus infects the sinuses. Think of the common cold. You might feel facial pain and pressure, experience nasal congestion, and have a nasal discharge that could be thick and colored. Viral sinusitis often resolves on its own, and treatment focuses on relieving symptoms. 2. Acute bacterial sinusitis. This type of sinus infection can follow a viral one. Symptoms are similar but often more severe, with the addition of fever and possibly a thick, green, or yellow nasal discharge. Antibiotics are the main treatment here because we're dealing with a bacterial infection. 3. Chronic sinusitis. If your sinus symptoms last longer than 12 weeks, it could be chronic sinusitis. Aside from facial pressure or pain and nasal congestion, you might lose your sense of smell or taste and feel fatigued. If allergies are at play, allergy medications might be prescribed. 4. Temporomandibular joint dysfunction disorder, TMJ. Though TMJ doesn't involve the sinuses, its symptoms can be mistaken for sinus pain. TMJ is characterized by jaw pain, restricted movement, and sometimes a clicking sound in the jaw when chewing or yawning. 5. Tooth infection. A tooth infection or abscess in the upper molars can cause severe, persistent pain and might even spread to cause sinus pain. Dental treatment, including possibly a root canal or tooth extraction, might be necessary to address the infection. Regarding when to contact a doctor, sinus pain is often benign and will pass, but some signs point to the need for a professional evaluation. If your sinus symptoms persist beyond 7 to 10 days, are getting worse, or are accompanied by severe pain, foul-smelling or colored nasal discharge, a fever, or a loss of smell, it's time to reach out to your healthcare provider. In some cases, emergency care is necessary. If you experience vision changes or pain or restricted movement in your neck alongside your sinus pain, go to the emergency room for evaluation. For at-home care, keep the sinuses moist by inhaling warm, humid air, using nasal saline rinses to clear mucus, applying a warm compress to your face, and keeping your head elevated during sleep. Over-the-counter pain relievers and decongestants can also be helpful. Before we wrap up, remember that this information is for educational purposes, and it's always best to consult with a healthcare professional for tailor-made advice. If you found this episode helpful, give it a thumbs up and don't forget to subscribe to our channel for more health insights. Stay healthy and see you next time.